Hello and welcome to Mental Health Monday. So sorry that we're late, guys, but we were having some issues with technology, but we are here now. And thank you for the faithful who stayed and waited for us to jump on. So thank you so very much. We appreciate each and every viewer and everyone who joins Mental Health Monday every single week. And we know that you are very busy right now because it is the holiday season and you still took some time to spend with us here on Monday to talk about mental health. Want to say welcome to my co-host, Dr. Ricardo Whyte. Welcome.
Welcome. Thank you very much. I am so sad to see that Clint's not here. How are we
I
going to do the show?
I don't know, but
But
Veronica is
Veronica's stepping up.
there.
Oh,
Welcome,
wow.
welcome.
Knocking Clint
Uh,
out of the number one spot. Okay.
yes. All right, guys, share this on your social media um, because we're talking about depression. And
Absolutely.
this touches every single human being at some level, at some point, dealing with it either for yourself or for someone else. This is like a topic that just everyone's affected in some way. So everyone needs to. Oh, Clint is here. All right. Clint is here.
Hey, Clint. Feeling so encouraged to see you there.
Yes, yes. And we're
Oh,
happy to see everyone. Please. Hi, Cherise. Hi, Deborah. Hello, false doctrines exposed. Nice to see you
so-
here as well. Please. Oh wow, Clint said he's been here for 30 minutes early.
we just didn't see the name
We
pop up
it just
for
didn't
some
pop
reason.
up. We didn't know. Clint's like, I'm never late, huh, Clint?
Well, maybe he didn't make a comment. So maybe he was here, but he just didn't make a comment. That's probably
Yeah,
what it is.
you usually make a comment, Clint. So
Yeah,
we just expect that from you. So I think
exactly.
that's why. So
Exactly.
yeah, please, everyone else, put in the chat where you're watching from. Say hello to us. And again, share on your social media. I'm hoping that we are on Facebook. I'm not sure if we're on Facebook today. It says we are, but I'm not sure because we were a little late. We might have missed that window, but we are definitely on YouTube. So we
Absolutely.
are happy to be here. So share it on your Facebook. Share it. Share the link. That would be great. All right, Dr. White. So our time is shorter today because unfortunately we started a little bit late, but this is our third part of depression because last week we talked about how the brain
The
can
the brain
retrain
that
it.
the brain that changes itself.
Right.
And what are the questions just started pouring in.
They
Um,
really did.
but we do want to finish up. We want to go out with a bang, if you will, with this issue of depression because we feel like it's just so relevant.
Oh yeah.
Now, is it me or are we picking up at cognitive factors, or did we get further than that? Because I'm sure you would know.
Mm, yes, I'm sure I would know. Actually, I can't remember to our last episode because we took such a long break there
Right,
before
right.
the last time. So I'm not sure. So it's not
We
gonna
can
hurt.
pick up there. We can pick up
Yeah,
there. Cognitive
yeah.
factors.
Let's do
Well,
that.
and put a 1 in the chat if you can
Mhm.
identify with at some point succumbing to negative thinking patterns. All right.
Mm.
So one of the issues is there are some cognitive factors that will contribute to depression, and one of them is negative thinking patterns. So, we're talking about recurrent negative thoughts. We're talking
Mhm.
about having a low self esteem, feelings
Mhm.
of hopelessness, a tendency to catastrophize. I'm sure you have been in the company of people who catastrophize. And
Right.
we're gonna go back and kind of go over each of these.
Mhm.
Um, but it's just to really emphasize that that your thinking and ruminating on these thought patterns can really actually lead to depression. So
Yeah.
let's go to the recurrent negative thoughts.
And I want to say before you even take that deep dive, I want to say the negative thoughts can kind of keep your homeostasis almost in a negative space. Like you're just people think like, "Oh yeah, I always think that way," or "I'm always just in that space," and almost make it seem like Those negative those negative thoughts and depression are your norm. Uh, and so that's so yeah, you're back. I don't know how you're
I had to reposition myself.
okay, all right. Well, you're repositioned. That's great. So I hope that makes sense. I don't know if you were catching what I was saying, that the negative thoughts will make it appear like our homeostasis is that's what it's just what it is. It's supposed to be, and it's just a continuation, and it goes on and on and on, and
Well,
things never
that's
change.
that's the craziest trick, that at times we can get trapped into believing that we don't have control of our thinking. And
Right.
we can think that we're just doomed to letting our thoughts just go wherever they want to. And
Mhm.
man, what a dangerous deception.
It is a day.
Rather than recognizing we've been endowed with the power to direct our thinking.
Yes.
And it is so critical for you to be able to interrogate your thinking.
Yes. Take it to
And
court. Put
and
on
this
put the
this
thoughts on trial.
And this is why it is so important to do the journaling,
Yeah.
because journaling externalizes your thinking and puts it in a context where it can be interrogated.
Mhm.
Because you're going to come back sometimes and just be like, I can't believe I was thinking that. Oh my
Right.
goodness. That makes no sense. It's almost like that's one of the first steps in you being able to identify that that thought pattern is negative and it doesn't make sense. Now, Sister Tante, you do quite a bit of therapy. What can you give some examples of some of the negative thought patterns you have encountered and have to work with?
Oh, there's so many all the time. But some of the most common is I'm not enough. Um, I'm not okay, so I'm not good enough. I'm not pretty or handsome enough.
I'm
I'm
not
not
worthy.
I'm not worthy. I'm not smart enough. People don't, no one really loves me for me. I mean, these type of things. Yeah.
What do people think of me?
Mhm.
And sometimes it's almost like a lot of these fit under the umbrella of imposter syndrome. It's
Right.
like you show up and you just don't feel like you are enough. You don't feel like
Mhm.
you're enough. Now, I know this isn't really like a spiritual program, but recently I went I was in a Bible study
Mhm.
where what they talked about was the 5,000, Jesus feeding the 5,000,
Mhm.
right? And more than that, it talked about how the little boy brings his lunch. Knew that part. We all knew that part. He brings his
Right.
lunch. Now, Sister Tante, do you hear the story as 5 loaves and 2 fishes? Is that how you hear it?
Yes.
Yeah, 5 loaves and 2 fishes,
Yeah.
right?
Mhm.
It turns out, it turns out that it's not loaves. It wasn't loaves. It would better be thought of as little saltine crackers.
Wow.
It's a little boy's lunch, so it's almost like a
Right.
Lunchable. So they're not gonna give a little boy like 5 loaves,
5 loaves, right.
and
I
it's
just
almost like a snack. But I always heard it as 5 loaves.
right, and I didn't get pay so much to the detail. I just knew it wasn't enough food to feed 5,000.
Well, but so here's the relevance. So it's
Right.
almost like here's this snack for the little boy. But now when you put it into God's hands, it feeds 5,000, and it was 5,000 men, which means by the time you got the women and children, it's probably 10 to 15,000.
I knew yes,
And then
definitely.
the cool part at the end is they pick up 16 baskets of fragments. And what
Mhm.
that does is it documents the multiplication, and number two, it documents satisfaction.
Right.
The idea being you are so enough when you put it in God's hands, it actually leads to surplus. It
Mhm.
actually leads to surplus.
You're more
What
than
what a vaccine against imposter syndrome.
Mhm.
What a
Yeah.
vaccine. Like so I think we're all crippled by imposter syndrome until we
Mhm.
realize, no, actually If you place it in God's hands, it will actually lead to surplus.
Yes. Yes. I love that. We have a question
Yeah.
Deborah's asking, but what about thoughts that just pop up in your thoughts where they came from and how to control them?
All right. So, where do these thoughts come from?
Mhm.
I think we could debate where they come from. I think we could debate that. What we will I think what's not controversial is they don't feel like they're originating in your thinking. I think we can all agree there.
Right.
Um Part of their disturbing nature is sometimes these thoughts are so disturbing, you're like, I'm thinking that, and like you almost internalize it like it's coming from you,
Mhm.
and it might not be coming from you. So here's the key, Deborah. The key is you can't necessarily control thoughts popping into your mind. What
Mhm.
you can control is, will you accept the invitation to dwell on it? Now,
Mm.
that you can control.
Mhm.
And I think a lot of times people do not make the distinction, and they just think a thought that pops into their mind they have to stay with, and it's not true. It's
It's
not true. So as to where they came from, that we could debate. But the bottom line is, um, there are what we talk about in the field as intrusive thoughts. They
not
just intrude into your thinking, and it invites you into the trap of continuing to dwell on it. You don't have to do that.
don't have
You
to.
don't have to do that.
So there's intrusive thoughts, and then there are, thoughts that, again, where you have always felt that they come from you. I mean, it's speaking in that first person voice. Like it sounds like you're just talking to, yourself, like you're a bad person, you're not pretty, you're stupid, you're whatever, those type of thoughts. And I've done this before here on this program and even for church service mental health programming. But what I like to teach my like clients is how to externalize those thoughts. And like Dr. White said, the way that it doesn't matter where the thought came from, it's what you do with the thought when it comes. So I like to teach my clients on how to be, first of all, pay attention and be aware of these negative thoughts, because negative thoughts have been coming for so long that it's just like everyday, basic, regular. This just seems normal. And so, taking time to become aware of those negative thoughts, you have the power in your brain to not accept it and even destroy that thought. However, you're going to get rid of that thought or, not accept it. You have the power to be able to do that. So, becoming aware of the thought and not letting it to take root in your brain, and as an external and outside of yourself, like it came, like this is not your thought, this is some foreign thought that wants to take root in my brain and make me not love myself or make me hate myself or make me not like myself. Like look at it as your enemy.
So you're talking about the awareness component. And
Right.
Deborah, I just want to add the cherry on top. I just want to add the cherry on top. And that cherry on top is, and then you divert your thinking to something meaningful. Like you divert your thinking to something that's going to really involve it. One of the things that'll make us more vulnerable to intrusive thoughts and invite us to then go into a negative pattern is when our thoughts are idle. Okay, when there's not too much going on. But now, instead of that, if I say, okay, well, let me organize my attic, or let me clean up my closet, or let me attack my to do list, it's going to be harder for those thoughts to take root. So that the idea is, rather than leaving the car in neutral, put it in gear. All right. Think of the mind as having gears. And I'm saying it's more vulnerable to these intrusive thoughts when it's in neutral. No, put that baby in gear. And now it's going to be a bit more immune to those thoughts. So reject the invitation to ruminate on it. And
Mm-hmm.
then also divert your thinking to something more meaningful. Wendy's
Yes.
asking a fantastic question here. Um,
Mhm.
communication disconnect between my children. Wendy, could you do me a favor and tell me what is the age that we're talking about as far as the children? So, communication disconnect between my children, and I can't understand why, so causes depression, disappointment for me. What is the age that we're talking about? That would be helpful so that we can contextualize our response. Sis,
Right.
did you want to tackle this first, or
Well, yeah, I mean, as a parent, and as a mother, like we definitely, I mean, I need more information on this, but I'm going to speak in general. Like, as a parent, we can, it just sounds like she's not happy with the communication she's having with her children. So, whether that's her adult children or younger children, it's like you're disappointed in the way things are happening and you're not, okay, adult children. Okay.
okay?
Period.
So
Okay. Okay. Very
21 and 30, 21 and 30. Wendy,
right.
thank you for that. Thank you for
Yeah,
that.
that is helpful. So,
Yeah.
um, not knowing the dynamics between, you and your adult children to why the communication is not good. I think number one reason why communication goes wrong with adult children is can be that we're not treating them like adults, if you will. Like if they're doing something that we don't approve of, or they're being independent and living their own life, it's a hard learning curve for parents sometimes to take a step back and to respect the fact that they are growing up and they're adults and they are in the driver's seat of their own life, right? Especially in religious circles. If you're a Christian family, right? When your children grow up and make decisions to do things maybe opposite of what you taught them or brought them up to do, sometimes that can be very difficult for parents to accept. So, I feel like a perspective change. I have worked with families where the perspective change that needs to happen again is so very difficult for parents with adult children. And when they do finally have that perspective change, is okay, let me not look at them through the lens of these are my children, these are my little kids, I'm their parent, I can still tell them what to do, or they have to at least, you know, consider my opinion and all these type of things where they're adults and they don't. And they but when there's a close relationship and they respect the parent's decision, that's always a great situation as well, but that's not always the case. And so stepping back and again just treating them like adults and respecting them can really just lay down a healthy space for the relationship and the communication to be like good things can grow from that. But and I'm not trying to put it all on the parents, but since the parent is asking the question, that is something a parent can do of adult children to help the relationship and the communication. What are
Right.
your thoughts, Dr. White?
So we always qualify. So please, like we can't emphasize this enough. We can't be your therapist because we don't
Right.
have the full on information. So
Mhm.
take our response in that context. Now
Yes.
that said, Wendy, I will share with you what tends to be my blind spot and what's my greatest challenge in interacting with my 21-year-old. Um, it is really hard to listen. It's really hard to listen, um, and then not provide my perspective even when it's not solicited. All right.
Mm,
It's really, really hard. It's hard to understand that sometimes people want a sounding board. They
mhm,
want a non-judgmental sounding board. And we often overestimate how big the window is for
mhm.
making our contribution.
Right.
We think the window is floor to ceiling
Mm,
when in fact it's really, really small.
mhm,
So there is a contribution to be made, but we first have to pay. The currency is really attentive, careful listening. And
mhm.
we often don't do a good job of that. You and I both know that while our kids are talking, we're thinking, you're crazy, you know? You know what I'm saying? I mean, I'm joking, but I'm dead
Right.
serious at the same time.
Mhm.
And sometimes we make the mistake of communicating that. And
Right.
nobody wants to be considered crazy.
Right.
Um, and so it takes heaven emptying the angels to restrain us and really and truly give them the experience of emptying their thoughts, of communicating where they're at, of discussing their pain, even mentioning the mistakes that they've made. And a lot of times, gently, they actually know you told them, you had
Oh, yeah.
told them.
Oh,
So
yeah.
so I think it can be really hard, and I've mentioned this on Mental Health Monday before. One of the sedative that I use, the medication, the salve that I use is it's her turn at bat.
Yeah.
It's her turn at bat.
Mhm.
Wendy,
Mhm.
we've had our turn.
Right.
And I think as parents, a lot of times we want our turn and then we want to steal our children's turn too. Like, if I was you, I'd do it like this, but it
Right.
ain't you.
And they don't even wanna hear that type of comment at all. Like,
It,
yeah,
it,
like you said, because it's not us,
it,
and they
it
don't.
ain't you. You had your turn. And a lot of us, when it was our turn, we did what we did because
Mhm.
it was our turn at bat. And you and
Right,
I also both know that it's not what our parent would have did in that situation necessarily.
right.
So it's their turn at bat. And one of the things that can really strengthen the relationship is if we do some effective listening.
Mhm.
So what it often will look like is if we're really trying to rebuild a relationship, sometimes we're able to say, you know what, I really owe you an apology. Sometimes you're talking to me and I really don't do a good job of listening. And I'm
Mhm.
sorry about that. And this year, one of the things I'm really going to focus on is really trying to listen and kind of wait till you solicit my feedback. But let me really give you an audience to
Mhm.
just empty yourself. And I'm
Right.
sorry when I haven't done a good job of doing that. Um, Now, Sherry, when I say we're not your therapist, like I could be telling you the complete wrong thing right now. You could have already done that. But
Right.
the purpose of our program is when issues like this come up, it allows us to kind of share some perspectives that maybe somebody else might find really helpful, even if it doesn't apply to your situation.
Mhm.
So I hope that Sister Tante and I were helpful in that.
Yes. We have another question. Is it possible that being brought up to be humble can cultivate a spirit of depression? For instance, a way of not accepting a compliment because parents fear you'll become arrogant.
So
Right.
I looked up the term humility, and humility is defined as a modest or low view of one's own importance, humbleness. A modest or low view of one's own importance or humbleness. I think one of the gifts that Scripture and the Christian faith gives you is it allows you to walk this very very cool middle ground.
Mhm.
On the one hand, you know that you are not less than anyone, and by the same token, you're also not greater than anyone. It's
Right.
it's modest, it's balanced. You know that it's not your job to be all puffed up, but at the same time, you know you are the child of a king. You have been made by God. But so's your neighbor. Your neighbor also has been made by God. So, Charisse, I think where theology and scripture often collapse is when they're taken to extreme and they
Right.
move away from the balance that wisdom would normally and would normally endow the principle with. There's a degree of modesty and a degree of balance. And so if the conversation around humility is one that is balanced, it should not lead to depression.
Right.
If the conversation is extreme and you remove either of those elements, that's where either person can become proud and have a false sense of who they are, or they can be extremely, as you're putting it, humble or have a very low esteem of themselves. And yet again, that's a false sense of who they are. So the goal is to stay on the cutting edge and balance it, and no, it wouldn't make sense for that to then cause depression. Um, I more see a toxic picture in which a person is like putting the person down, suppressing. Well, the reality is you have to go against scripture to do that, because the reality is that child is a child of the king.
Mhm.
And before anybody gives you a compliment, that is a true statement. You have been made to be like God. That's how
Mhm.
you've been made. Not God, but like God. So you tell me where you should be walking around with your head down, with that being a reality. But by the same token, when you know your neighbor has also been made to be like God, you also understand I'm not greater than that person. We've both been made in the image of God.
And I just want to say, I mean, that sounds really extreme, like not wanting your child to accept a compliment because you're afraid they're going to get a big head. Where, and I know this person is an adult now, not a child, but in this world, in this sinful world where we started off talking about negative thoughts, like most people have a ton of negative thoughts going on in their head. So for somebody to say something nice and for them to be polite and teach them to accept, that to say thank you, when somebody says something nice and polite to them, and not are teaching them not to accept that or not, I don't know, like say, I guess, thank you when somebody says something nice. I just think that definitely would do a person a disservice when we have, again, so much negativity and so many negative thoughts going on in the majority of people's heads that are walking around today. It's just like, I think that's unfortunate.
And can
Just
we
think
just,
that's unfortunate.
well said, sis. And can we just say, when a person gives something, it can be a really, really good feeling. And if we reject the gift, we can be interfering with that person experiencing some good. So it's actually a generous thing to accept a gift. So, for example, if you guys have gifts for me, for example, I want you to, I'm just joking, but I'm totally joking. But
Yeah.
the idea is, it really is an awesome thing to give a gift. It really feels good. All right,
Yeah.
let's knock these out so that we can like push this further along so we can finish this topic on depression. How do you break the bad habit of negative thinking? I'm going to just say, number one, you should pay attention to what is feeding your thinking
Mhm.
and find resources that actually uplift. So, this is where self help books help. To me, this is where scripture helps, where you understand what
Mhm.
God thinks of you. But it's not going to be surprising that you have negative thinking when you're surrounded by people that feed those negative thoughts. You're consuming material that feeds those negative thoughts. You
Mhm.
yourself are thinking those negative thoughts. You're not externalizing those negative thoughts so that you can interrogate them. If you want to break the negative thinking, you're going to change your surrounding to positivity. You are going to get self help content,
Mhm.
consume it, and you're going to externalize so you can interrogate it and call out the fallacies. What were you thinking, sis?
I was exactly what you're saying, to interrogate it, but to also replace those thoughts with positive thoughts. But you have to be intentional about that. So when the person's saying, how do you break the bad habit? Well, you're going to, it goes back to our Atomic Habit book, but you're going to have to want to make 1% change a day. And how I like to help my clients and talk about affirmations. So you're going to, I have them write down 3 affirmations, 3 positive things about themselves, or to even replace, or we might talk about the negative thoughts that they have, right? So about themselves. And then we have a replacement thought. So that might be for be the new affirmations that they're going to do, is to have the replacement thought to deal with that specific negative thoughts that they're having. And so you're going to have to put positive stuff in, and that doing that every day is making that 1%, maybe that's more than 1% change a day, but you're putting positive thoughts into your head and replacing those negative thoughts that you're hearing. I mean, that's just one way. Everything that you said is also a very positive way to be able to break that habit of doing negative thoughts, but that's just another way that I like to help people with as well.
No, that's beautiful. And so I just wanted to, run down. So we mentioned recurrent negative thoughts, low self-worth, that's pretty self-evident. Hopelessness, I think that's pretty clear. Catastrophizing thinking. Let me give you some examples of catastrophizing thinkings. It's a person who says they have a headache, so it must be a brain tumor. Okay. And they're probably going to die soon. That is an example of catastrophizing. Let's say, for example, work performance anxiety. The person made a mistake on the presentation. So everyone will think they're incompetent and they are definitely going to lose their job. That would be an example of catastrophizing. And another one is, like, let's say for like relationship issues, the partner has not texted me back all day, so they're probably mad at me and planning
Yeah.
to leave me. Those are examples of catastrophizing.
Mhm.
And
That has a
so
lot to do with anxiety too. Some of those negative thoughts are just founded and, grounded in anxiety. So an extreme anxious person would think that way.
right, but they might be clinically depressed, so that rather than
Mm,
getting frustrated with them, please understand that they might need some professional intervention,
yes.
because these at times can be signs of clinical depression. So
Mhm.
that's catastrophizing. The other
Yeah.
one is learned helplessness. Like,
Mhm.
you know what? Like, learned helplessness is so powerful because, Sister Tante, would you agree that, like, it's very few people that escape their childhood without trauma?
Uh, I personally feel like in this sinful world, on some level, might be a trauma with a little t, a lowercase t, but on some level, everybody experiences some type of trauma.
And the problem with trauma is it can give you this feeling of learned helplessness. So if you want to understand, like, from a scientific standpoint, what they would do, for example, is they might shock an animal every time that it tried to maybe self-dispense a nutrient, and they would shock it and shock it and shock it until it just stops. It just stops trying because it's just sick of it. It's learned to stop helping itself, learned helplessness. And you can see how there are children who they tolerate so much verbal abuse. They have
Mhm.
to deal with parents that rage at them. Sometimes it's that they got bullied. And it's almost like their soul has been taken from them in many ways. They have a hard time with passion. And I'm telling you all of this because my prayer is that you would pause and you would
Mhm.
do the best that you can to protect your children from this trauma. And
Yes.
some of it is from you. Some of it
Mhm.
is from you. I know children can be so provocative. I know they do things that can send your rage up into the third heavens. I get it. I understand. But
Mhm.
what you are preserving and what you're saving them from when you can learn to be patient and instead be constructive is
Mhm.
you're protecting them from trauma, okay?
Yeah, you are.
And from trauma from the person that they trust the most, okay?
Mhm.
You've been entrusted with that position to actually protect them. But no, I know we can go through some very provocative situations, but learned helplessness, that's a really that's a really powerful cognitive contributor to depression.
Mhm. I wanna take Veronica's question, but I want
Yeah.
you to talk about, your I'm gonna call it the wrong thing. So I wanna talk about the new, thing that you're offering to
Oh, so yeah, so I'm doing coaching consultations. I'm doing coaching consultation where, in a 45-minute block, we can actually adapt some of the concepts from the Mastermind Institute to
Yeah.
your situation. So Amra might be able to put the link in the chat, and you'll find it in the private chat, Amra. Welcome back, Amber. By the way,
Yes,
she
Amara's
has
back.
recovered. Thank goodness. And hopefully she's there.
Yeah. So no, she is. The link is in the
Is in the
chat.
private chat. Yeah.
No, it's in the regular chat now.
Oh, okay. Oh, okay, okay, okay. All right.
Yeah.
Yeah, it's awesome. So so this affords people the opportunity to now get us, or at least get me to adapt to their specific situation. So just some powerful concepts that, when customized to what you're going through, it can be a real blessing. So I introduce you to the power of the seven vitals, and then showing you how it can empower you in your personal life. So thank you, Sister Tante, for
Yes,
that plug.
of
um
course.
yeah,
Of
go for it.
course.
All right.
All right. So Veronica is asking, is it a good idea to directly address someone who is still making you feel like you are not enough? Or should you just deal with it on your own?
So you want to dive in? Oh,
Um,
yeah.
well, okay. Okay. I might as well take a stab. Okay. We don't know. Okay. This is to directly address. So, I mean, I guess you're saying confront. That's what I'm assuming she is saying, to confront this person. Um, and I don't know if you're saying, should you stay in a relationship, whether this is a friend or I don't know who this is, but or family member. I like to give this example, meaning if parents feel, it's definitely in certain cultures, they definitely feel that they cannot lose the parent card. Do you understand what I'm saying when I say the parent card? Meaning you're my child. And even if you're not happy with this relationship, and even if I'm talking, down to you or treating you like a child and you're an adult, or our relationship is abusive, you're still my child and you still have to spend time with me because I'm your parent, or, respect me in a certain way because I'm your parent and all of this stuff. If you're in a relationship with someone, I use that to say, if you're in a relationship with someone and they are making you feel that you're not enough, or telling you things like you're not enough, or treating you in a not in a good way, in a respectful way, it doesn't matter if it's a parent or a friend or whatever. uh, okay, well, it doesn't matter who it is, they can lose that space in your life. Let me just say it that way. Because you have to protect yourself. You have to set a boundary from someone who's not respecting you or making you feel that way. And they just think like, well, we're family or we're friends or whatever. You're stuck with me. So you kind of have to take this. And you don't.
Sis,
Go
are
ahead.
you bothered at all by that phrase, making you feel?
No, that doesn't that no, I'm not bothered by that phrase.
And
Tell me why.
and and where I'm struggling with it is, so for example, sometimes we might say, you made me angry. And
Mhm.
what I
I
think that,
understand what you're saying.
yeah,
You have a choice. You have a choice.
okay, so there's a degree to which I can choose how I can respond, number one. But number two, one of the things a lot of times people miss is the pre-existing rage that's there, that
Mhm.
then I say, well, it's that person that did it.
Mhm.
So for example, and Veronica, this might not apply to you, so let me just toss that out there. But like, I come home, I've had a horrible day, right? Had a horrible day, and let's say, I don't know, because I'm trying to not say something chauvinist, right? But like, I come, how about my wife had a horrible day at work, and she comes home and there isn't dinner on the table. How about that? How about we reverse it? Right?
Okay.
All right.
Okay.
Now there isn't dinner on the table. Um, and yeah, that's a little irritating, but she comes home and she totally thrashes the place, right?
Mm. Mhm.
Well, it's understandable that a person might be upset that dinner's not on the table, but I think we would all agree that thrashing the place is outside of what would be the appropriate response to dinner not being on the table. I think we can all agree to that.
Right.
So in other words, I brought something to this. And sometimes when we say people make us feel, we can miss that. Well, what did I bring to the equation? Now, more to the question, when we say that a person made us feel less than, was there some feeling of feeling less than before they did anything? Okay. So that
Mhm.
even if they did do something, what if I kind of brought that there?
Mhm.
And the
Mhm.
reason for this kind of work, the reason it's so critical is because the person could be set up for failure, where it really doesn't matter what they do, because there's this pre-existing feeling that I'm inadequate. No matter what they do, even when they fix it, that's still going to be there.
Mhm.
So
Mhm.
that's why that language of "you made me feel" is something that I pay attention to, but I don't want to dismiss that people can contribute to bad feelings.
I was just,
So,
yeah.
so all of that said, there's a book, Crucial Conversations, right? That talks about how to conduct high stakes conversation, really and truly, kind of how to hold people accountable, and how to let them know it's because I care about this relationship that I'm going to take the risk and have this conversation.
Right.
And
Right.
I might make some mistakes, but it's because I care about the relationship that I want to take the risk.
Mhm.
So that book, Crucial Conversations, might be helpful.
Mhm.
And nowadays they have the books on audio. Sometimes you can hop on YouTube and there might be a summary of it.
Mhm.
But I think when we predicate the conversation with, I want to have this conversation because I care about the conversation. I care about you. And
Mhm.
I realize I may come at you the wrong way. This is where Sister Atonte's slow startup is so critical.
Mhm.
She talks about, look, man, start with a slow startup. So that would be an example of a slow startup. I
Right.
care about you. I'm sorry if I make a mistake, but I do want to say, the way you've been coming at me hurts. It really hurts, and maybe you can explain yourself,
Mhm.
because maybe it's not what you're trying to do, but
Right.
I'm really feeling it's really bothering me, and I'm hoping there's something we can do because I value this relationship.
And that's always the best way to come into any conversation that you think is going to, that is a difficult conversation. You have to come with the soft startup because the walls of the other person are going to go up, and they're just going to think like, I got to defend myself, because they think I mean, if you do a hard startup, they think you are coming at them swinging. You know what I'm saying? But when you come with a soft startup, their defense mechanisms stay low, they stay down, and they actually hear what you're saying, and they can connect to your heart, like they're really hearing what you're saying. The only reason why you'd want to have a conversation like this with someone is that you're in a close relationship with this person. This is somebody that you care about. So this
Yeah.
is either, this is somebody that you care about and you love. So, and you care
Yeah.
about the relationship.
Absolutely. So, and I hope that was helpful, Veronica. So next, there are lifestyle factors that contribute to depression. Um, Big one is lack of sleep. Lack of sleep.
So
Um,
huge.
Man, I can't put.
We could do a whole program on that one.
Oh, that's real talk. That is real
Yeah.
talk. And
Real talk.
there is the book. There is the book. Oh, it's right behind me. Um, it's like right behind me. My wife wouldn't stop talking about this book. It was so funny. But yeah, yeah. Why We Sleep by Matthew Walker, by Dr. Matthew Walker.
Why we sleep.
Um, yeah, just a phenomenal book on sleep. By the time you're done with that book, it's like you're like, I'm going to bed. Yeah, you want to
Right.
hear something cool? You want to hear something cool? So my television, and uh I try to get quality stuff, but so super nice television, it just stopped working.
Yeah.
Sis, I have been getting so much sleep
Because the television
because
spot. Yeah.
there's nothing else better to do. So we're turning in. It's but
Yeah.
it's just so funny. But man, sleep.
It's
Oh
it
man.
it's huge. It's huge. Like I think I was talking, was it? No, I think it was this Sabbath when I was answering some mental health questions. talking about exercise and how important it is for the mental health, but sleep is just as equally important for our mental health. And like when I'm working with clients that are dealing with depression, I'll have this whole sleep hygiene conversation. I'm going to ask them like, how many hours are you getting? What hours, when are you going to bed? Because not just how many hours you're getting, but when are you starting to fall asleep? And so there's so much more to it than just
So
getting in the bed.
here's a 5 minute, because now you can take notes on this. I'll say it
Yeah.
quickly, but then you can slow it down and take the notes that you need to. So one of the critical things that sleep does is it allows the subconscious to deal and work on the problems that you've been having consciously. It's like the
Yeah.
conscious thoughts submerge into the subconscious. Now it's like infinite intelligence is working on them, and it gives you the opportunity to wake up and have a different perspective of it.
Mhm.
Dreaming. Dreaming allows the mind to re-represent the issue to you in a different way. So one of the things that you should have a writing pad and a writing instrument next to your bed and make an effort to write those dreams down,
Mm,
because your brain is trying to tell you something. And
mm,
then when you put the context of the dream in the context of what's going on in your life, it allows the key for you to then interpret the dream, and sometimes even God is talking to you in your
mhm,
dreams. The other thing is, how do you get a good night's sleep? What are the things you need to do? So it starts with, there are chemicals that position you for good sleep,
mhm.
or that are prone to disrupting good sleep.
Right.
Caffeine is a notorious disruptor of good sleep. Okay.
Yes.
I believe
Yes.
the half life is like 12 hours. So, what that means is that it takes a long time for it to actually get out of your system. So, you want to be aware of that. So, you got to get stimulants out of it. And then you need sufficient physical activity, but
Mhm,
not just that, you also need sufficient mental activity. So there
mhm,
are people who they'll exert themselves mentally and still be like, "Hey, man, why is it I can't go to bed?" And vice versa. You exert yourself physically, but you don't do anything to stimulate yourself mentally. So exert yourself mentally, exert yourself physically, and then now you need a calming pre-sleep routine. For some,
got
it
it.
might be a shower. And guys, I'm adding like the cold, like the 3 minute cold thing at the end. That thing is awesome, man. It is
It's
awesome.
good for your
Um,
immune system
so
too.
yeah, and you're like, hey, so, but what do you do with the pain and everything like that? Focus on your breathing. I just go just like this, and I feel deep breath in, deep breath out, and you're rocking. And you would be surprised at how you then can acclimate. And
Mhm.
supposedly these cold shock proteins go throughout your body, stimulates your immune system. You feel so exhilarated, and you feel like, man, I did something hard. That's what's up. There's somebody like, man, they're wimps. There's somebody
I
doing
think
all.
we I think we shouldn't do a drive-by on this topic, meaning, like, I think we should give it its due because it is such an important thing, like, almost when we come back next year, because yes, this is our last, episode for 2024, but I think when we come back next year, we should definitely maybe pick this up because
You
there's so much here, to share, and it's so very important, and you would say, "Oh, young people, they miss it." No, as adults, we miss it too. And there's so much here. I mean, we're on our phones late in the evening too. Just even the lights. There's so much. So I don't want to give it all away, but sleep hygiene, even how to prepare to go to sleep, is a huge part of that as well. To just be able to go to sleep at the right time and get that proper rest.
so for
So,
those of you who wanted me to finish, book a consultation. You
well,
see which
that
one.
too, and yes, that too, and I think we should do a whole program, a
No,
whole
no,
program.
like I think maybe we take a look at why we sleep, and pull out some juicy topics from there, and obviously support the author as well. But that could be something that we definitely take a look at. We
Definitely.
still have to cover social and cultural factors, and then other risk factors as we talk about depression. But
Because we're
yeah,
out of time,
yeah,
but we
yeah.
can we're always gonna come back and revisit that.
We're gonna come back and
We can
revisit it. Yeah,
in the new year, we can, start our program off with this, go into the sleep. We host our own show. There's lots of things we can do. You guys just come back. You guys have to
absolutely.
stay with Mental Health Monday and invite your friends, invite your family. I mean, because this is good information, guys. This is great information that we're trying to share.
Absolutely. One thing is for sure, we are going to continue to deliver to you information that is as valuable as possible, that you can work with your personal mental health team, but then
Yes,
incorporate it into your life. So, look, happy holidays to you. We know that sometimes this can be a stressful time
yes,
of the season, and so our thoughts and our prayers are with you. Please make it safe holidays.
yes.
Make good decisions, and
Yeah, don't let it don't
remember
let
the
it stress
reason
you.
for the season. Go ahead.
Yeah. Yeah, I was just gonna say, remember the reason, the real reason for the season. Don't let it stress you. It's not all about the gifts. Really spend time with family and set boundaries, like financially, like don't overextend yourself financially because you're just gonna be mad at yourself come January 1.
We were
Take
talking about trauma earlier. Did you
Mhm.
know that it's estimated that like trauma against children skyrockets in the early part of the year, and it's like connected potentially, possibly to like overspending during the holidays? Like,
Yeah,
anyway, that is
yeah.
conjecture. So that is conjecture. I do not know that for a fact. It was just something interesting, an interesting piece of folklore that I heard. But what
Right.
we are saying is please be careful. And the real emphasis we're championing is spend some time with loved ones. We don't
Yeah,
know what the year is bringing,
you never know.
so that value that time. Really see what you can learn from
Mhm.
your loved ones, especially your aged loved ones who you don't know if this is the last, if this is the last season.
Right.
So make the most of it and be present. Be present for it.
Present. All right. That's great advice. That's great advice. Well, wishing you a Merry Christmas and a Happy New Year when it comes. And we're wishing
Thank
that
you.
to all of you. And we will see you next year right here on Mental Health Monday in January. So we're
Happy
looking forward
holidays to you too, sis. You and your
to that.
family. Yeah.
All right. Looking forward to seeing you guys back here. Have a good evening. Bye bye.